So Elon Musk's Doge is looking for new ways to cut federal jobs by expanding the scope of what it considers to be DEI roles. The Washington Post uncovered internal Doge documents laying out this plan of attack. Now, the new target, employees who work to protect equal rights. Quote, in the coming weeks, Doge has planned to trim staff from dozens of offices across the executive branch, including those that protect employees' civil rights and others that investigate complaints of employment discrimination. But the purge goes well beyond those roles. NPR reports as many as 1,500 employees at the National Institutes of Health were let go on Friday. I wonder what jobs they had. The NIH did not respond to NBC News' request for comment on the matter. Joining us now, Dr. Matt Brown with NIH Fellows United, a union that represents early career researchers and others at NIH. Welcome, sir.
Thank you so much. It's a pleasure to be here.
Dr. Brown, as in Dr. Brown with a PhD in neuroscience from the Johns Hopkins University School of Medicine. Can you just explain to us a little bit what you do so that we understand more generally what NIH does?
Sure. I'm a basic science researcher at the NIH. I'm a postdoctoral fellow. That means that I spend my time in the lab doing the basic fundamental research that we hope sometime, somewhere down the line, will lead to increases in therapies and cures for human diseases.
Okay. And that is sort of more broadly what NIH does. What does it mean for NIH then if funding is getting cut?
Well, it's going to handicap the United States' competitive advantage that we have as being the leaders in biomedical sciences across the world. And so it's not just the intramural program where we do research at the NIH campus in Bethesda and at NIH campuses across the country, but there have been significant cuts to NIH funding grants that will go extramurally to institutions across the country.
Right.
So the cut in these grants, because the country's being told, is that that's wasteful spending. Mm-hmm. That's fraud. That NIH is fraud. Help folks understand what it means to cut $1 of research funding, how that translates into a shot that they're going to need, a pill they may need to take, or therapy that may help them with other ailments that they may have.
Yeah, I'd be happy to explain that. And so there's no more low-hanging fruit in science, right? The problems that we're trying to tackle in biomedical research, such as curing Alzheimer's, kidney disease, heart disease, diabetes, whatever it is, those things are really hard and really complex. That takes a lot of money, it takes a lot of work, and it takes many other things that probably don't even come to mind. Specifically, when we're talking about these extramural cuts to NIH grants, these are cuts to what are called indirect costs, and that sounds very amorphous and kind of hard to describe. But in the lab, we require very specialized equipment. We require people to help us procure that equipment. We require people to help us reach out to the public. All of these things fall under indirect costs that are critical for our research, but still may be funneled into this sort of indirect costs category that sounds very difficult to describe. But it's still critical to us getting to these therapies and cures that we're working towards.
So not only are they cutting funding, though, they are firing people.
Yes.
Right. Yeah.
Yes.
And again, under the umbrella of waste and fraud, okay, and I'm just
DEI.
and DEI. This from the Washington Post, Trump's federal firings imperil government services from cities to farm towns. At the National Institutes of Health, an unknown number of key staff are being let go, posing a potential threat to patient safety, said a person familiar with the matter. NIH probationary employees include doctors, nurses, pharmacists, and respiratory therapists, people who have spent years earning multiple degrees and qualifications. Even on Friday, the National Institutes of Health terminated some researchers. Is this waste and fraud? And I mean, just what are you hearing from the people that you represent who are being targeted because of DEI? I do not understand this.
Well, I'll tell you, I talked to many researchers that our union represents on Friday that were going through panic attacks all week, that were just recovering from panic attacks after I had talked to them. And it was just an incredibly dark week at work, right? And it's not just the losing of the jobs, because obviously that's awful, and obviously that's going to delay research. But some of these things that are harder to see is this chilling effect on research that might have. Why would I be the one to take on this multi-year complex project to solve Alzheimer's or ALS if I could just be terminated at any time? Why would I be the one to try to solve heart disease, something that could take years and years of my hard-working time when I don't know if the money will be there? That's what I'm afraid of. It's not just these terminations, which are having a really awful effect on people's individual lives. It's also the effect of the endeavor of science in America. Why would you be ambitious? Why would you be curious when there's so much uncertainty?
Are people getting severance? I mean, I think people out there they would think, oh, people are getting fired from the federal government. They'll be okay. They're getting severance. They're getting paid out.
That's hard to say at this point, right? Because the administration has been so unclear with how this whole thing works. We are still gathering information about the kinds of employees, the kinds of researchers that were fired from the NIH this past week. And so we don't know.
We talk about the fact that all of this research costs a lot of money. It also costs a lot of money to not tackle something like Alzheimer's, right? You think about the fact that the baby boomer generation is now sort of coming of age and coming to a point where you've had a lot of folks say, we're going to have a national crisis on our hands because when you have this illness that we have not yet found a cure for, and you have what had been the largest American generation aging, you have a care crisis, right? So we are going to bear the cost, whether that cost is in research or that cost is in care, one way or another. That's one component. The other component of it is just our global competitiveness, which you referenced, but I want to make sure that we tease out this from the Washington Post. For 80 years, the great research institutions of America have enjoyed a special relationship with the federal government, one that has powered scientific and technological innovation and made the nation's universities a magnet for the world's most brilliant scientists and engineers. Here's the part I want to underline. Research leaders contend that the NIH decision will damage America's ability to compete with China and other nations on the frontier of biomedicine. Why does that matter for our national security?
Well, throughout my career in science, I've met people from all across the world that come here to the United States, whether it's at universities or at the NIH, because they know that this is the best place to do biomedical research in the country. And
in the world.
In the world, pardon me, excuse me, yeah, in the world. And so losing that by cutting this funding and handicapping our ability to do this world-leading research is going to make those people look elsewhere. And because they want to do the best science, and we should want those people to do the best science here.
Can I just real quick, I know we got to go, but I think the capstone of this for folks are the headlines that are popping up around the country. Just so folks out there across the land think that this is not real, it is. Life-saving research in Alabama, gone. Cuts threaten Northeast Ohio's biomedical research industry. Funding cuts for health research in Texas. Georgia. Oh, yeah, biomedical sector risking research jobs, experts say. Florida, well, all those folks you were just referencing, Alicia, could lose millions of medical research dollars, sparking fears that lab lights will go out. That's what Donald Trump is doing for y'all, America. It's cutting off the research dollars that could save your life. And I don't understand. I get where you are, Matt. You have to walk this tightrope between the folks you represent and an administration that doesn't give a damn. And that's what makes this extra hard, because a lot of people are going to get hurt.
Matt Brown, Dr. Matt Brown, thank you so much for being at our table.
Thank you for having me. It was great.